Exactly.
So it randomized people to 2 different levels of diabetic control, and it established that it mattered. We need that for phosphate, right? We need to do a trial that shows that does it matter whether you achieve a phosphate of 6 or a phosphate of 4.5? Because if we can't show that it matters, or that we do harm, more harm than good, then it changes everything. We need to, we're spending billions of dollars giving people so many drugs, trying to reduce a blood value that we aren't entirely, I mean, we think that it matters, right? But we need to show that it actually matters. So my sort of dream trial is, I would love to I want to get rid of this. We're killing people with calcium.
Exactly.
We use calcium because it's cheap, but that rationale is so illogical, it's crazy. We would rather give people a cheap drug that we have no idea if it works in terms of making them better. We're pretty confident it kills them, right? Rather than anything else. So we need to do a trial that shows no treatment to a particular phosphate, and whether or not you get calcium as that therapy. You know, it's sort of like aluminum. We would never give aluminum anymore, but it took tragic, events to make people to stop. You know, so I think we're there with calcium. We need to pull our head out of the sand and stop treating people with calcium just because it's cheap, right? I mean, I wouldn't treat my family with calcium.
So is there any lower limit of calcium, like 7, 7.5, 8 when you give calcium?
What patients on cinacalcet of yours do you start calcium?
Yeah, very few. I think that if your calcium is below 7.5, I consider it. If your calcium is below 7, I back off on the cinacalcet. Yeah. You know, the interesting thing is, you know, the data on cinacalcet and outcomes is, I don't think it matters what PTH you get to with cinacalcet. I think what matters is that you're reducing calcium, you're reducing phosphate, and
FGF.
Yeah, and people live longer. So it almost doesn't matter to me. I don't need to give a dose of cinacalcet that's going to make them so low on their serum. I have to give them calcium. That's a bad idea. So if I get that point, I back off on the cinacalcet, right? So if on 30 milligrams, it's pretty unusual to get really low on 30 milligrams. But if you're on 30 milligrams and it's really low, I might give a little calcium at night to help bring it up. But once you're above 7.5, I don't see any reason to do more. Yeah. Thank you guys.
That's really
Yeah.
good. That's good.